Yes, welcome to the Thursday, March 14th, 2024 Beat Cancer Answer Call. We got a bunch of coaches online right now. If we don't get any random callers in, we'll just talk amongst ourselves, and we always have good topics to talk about. Just as a reminder, nothing you hear here is medical advice. It is healing advice. So you won't get the type of advice here that you get in the doctor's office for sure. But you're supposed to go to your medical professional. That's what I'm supposed to say, right? Go seek medical advice. But please, anybody with any questions, go ahead and ask. We got Trina on the line now. That's very good. And I will mute people that have background noise, but it's very easy to unmute yourself. If you're on the phone, just hit *6. That works for muting and unmuting. So if you hear you've been muted, it just meant there's noise in your background. And if you're on the computer, either the little red microphone icon in your picture, if it's muted, you can just unmute it there, or go to the bottom left-hand corner to the microphone icon, and it's blue when it's hot, and it's red with a line through it when it's muted. Okay, and I think that's it. So with that, we'll get started.
I have a question.
Sure.
Does anybody have or want to share information on lion's mane?
The mushroom. Yes, very, very good.
Very good.
Yeah, my girlfriend's actually taken up a hobby growing mushroom, and that's one of them.
So I guess one of the issues why I bring that up is I've heard a lot about lion's mane, and and I picked up, actually my naturopathic doctor also recommended it, and not only with the history of cancer, but also tick-borne illness. I found that it's very beneficial. So I decided to pick some up at the health food store, and I tend to not take full doses on the first time. I took the half dose with my meal, and about an hour and a half later, I woke up with AFib, and I spent 2 days in the hospital with AFib.
Wow.
I asked my doctor, I said, so, because it just was ironic to me that I had just taken that supplement, and within a couple of hours, my heart felt like it was beaten out of my chest, and it was very irregular. And so I asked the doctor, do you think that had anything to do with it? And he said, no, I don't think so. But then I also looked up information on these blends of mushroom, these blends of supplements, and how a lot of them don't have the actual product in it. And there's a thing called mycelium, was one of the components. It's a filler of these mushroom blends that that can have adverse effects. I was told that I was going to have to go to be cardioverted because the IV medication to regulate my heart rate, they couldn't use because my blood pressure was so low, and so they stopped that drip, and they were going to send me to be cardioverted to Manchester, New Hampshire. And so about 3 o'clock in the afternoon, my body just fixed itself, and my rhythm just went back into normal sinus rhythm, and has been ever since. And I just kind of wonder, I still kind of, in my gut, am hearing that it was an adverse effect, and that maybe I can't do these blends because they have so many other things in them, and you don't really know sometimes what you could be reacting to if you're reacting.
Yeah. Mycelium is a component of the mushroom for sure. That's how mushrooms grow, is the mycelium.
Mycelium.
And you might have a sensitivity to mushrooms.
Yeah. Or one of the ingredients for sure.
It could be. So may I suggest one mushroom at a time? Start with.
See, that's the thing. That's the thing is that I think with everything it has to be one at a time with me, because every time that I've done a blend of anything, I end up either throwing up or reacting, somehow. Because I did that with the thyroid blend as well, and I ended up going to work and throwing up work. So for my body, I'm kind of convinced that the blends don't work. The individual components. That way, if I'm reacting to it, then. But I have heard that so many great benefits of lime, and different mushrooms,
There's a lot going on there, and there's the sense of how your body reacts to certain things as an individual, but also in regards to kind of getting nauseous when you take supplement blends, are you consuming them with food or on an empty stomach or on a full stomach? Because I've found myself as well, if I take too many supplements, not that I often take supplements in general, but when I do, if I take a good amount and I haven't eaten anything, that's not a good time. And I'm really absolutely
correct.
And the reason for that is you are giving your body or your gut such a high concentration of nutrients that it's just it can't handle it. But when you have it dispersed kind of amongst a whole meal's worth of food, it kind of allows it to more slowly and comprehensively be digested.
Another times I took it with food. Yeah.
Got it. So then, obviously it's just one thing to consider. Another thing is in regards to mushrooms specifically, if I recall correctly, women and women's bodies can actually be more sensitive to mushrooms specifically, and anything like plant, or not mushrooms are a plant, but in the nightshade family, in the nightshade kind of consideration of things.
Yeah.
Women can be often more sensitive or experience kind of side effects. So that's something to consider as well.
What brand was it? Sometimes the brand.
It's New Chapter. Or New Chapter.
I haven't. Hostess is a really good brand.
Yeah, I don't. There's a lot of different brands out there. There's a lot of dirty supplements too. Like,
right. Exactly.
You got to really be careful about who. I'm not gonna.
This is the New Chapter.
Okay.
Yeah.
Okay, so there may be something in it that you're sensitive to.
Right.
So try not to use a blend, and just if you're going to have mushrooms, like use just shiitake or just the button mushrooms or whatever brand you want to use. Use the mushroom as a mushroom. But while we're talking of mushrooms, maybe we should discuss what some of the advantages are of them, because they contain great cancer fighting properties. They are actually great at boosting the immune system. They help lower your cholesterol. They're high in vitamin D. They actually can help with aging. They help with depression. Especially they've triggered that depression in cancer patients for some reason. They're less depressed if they're eating mushrooms, believe it or not. And what I found also that it's for your gut health, and they're really, really healthy for your microbiome, and they are so rich in vitamin B and niacin and riboflavin, and you're healthy functioning for your skin and for your nervous system. There are so many wonderful advantages to mushrooms, and try to incorporate mushroom as well as garlic and onions into your diet whenever you're eating healthy food, or having salads or cooking up, because there are so many wonderful advantages, and they're synergistic in a way that they work together. Garlic. Look, it boosts the immune system. It's good for your blood pressure. Improves brain health. It's great for lowering your cholesterol. It actually helps detoxify heavy metals and helps with digestion and keeps your bones strong. So between mushrooms and garlic, and I mean, when you're going to have garlic mushrooms, you got to put some garlic in it when you're cooking them. So just to me, it's a must. So why not take advantage of finding the best things that work together for you? But I suggest one brand of mushrooms at a time, and if I were you, I'd avoid the blends.
And the actual product rather than the, because, I don't know if anybody's heard of
the product itself and not to,
Right. And I don't know if anybody's heard of resveratrol. That's also a, so Japanese knotweed, I do very well as long as it's just not the knotweed. But resveratrol from a blend, I don't do well. So I guess that's just, we all have but I have heard
did you
so
have
much
limes?
about it. Huh?
Did you have limes?
It wasn't, I
Lyme?
wasn't diagnosed with Lyme.
Yeah.
I was diagnosed with tick-borne illness.
Right.
But,
Right.
but the Lyme test was negative. And of course, in naturopath, what's the other one that is, that they use to test?
There's Lyme's literate doctors that are more in tune with the Lymes. That there's a huge controversy in the industry. Hematology. I don't know who would be studying Lyme's, but they say, Lyme's literate doctors are quacks. But in the meantime, a lot of them are on the boards of pharmaceutical companies that are trying to come up with Lyme's vaccines.
Yeah.
So that's the things that we've been finding out.
Yeah.
But I've gone through it twice, and I was diagnosed as not having it.
Yeah.
There's a more comprehensive test that can tell you all the different types of tick-borne illnesses. Like,
is that the Western blot?
No, that's the standard test. So the Western blot, it kind of says, it shows acute and residual. So, but if those two tests don't agree in the Western blot, they say you don't have it. So I had it for too long, and my acute was gone, but I had the residual, and then ultimately the county called me and said that I had it. So I went to a Lyme's literate doctor, and they did a more comprehensive test. And there's several different things. There's different spirochetes, I can't remember, Bartonella and other things, that are different types of critters that get in you from the Lyme tick itself, and it's not Lyme disease. And that's what gives people the chronic fatigue and the MS symptoms and just a bunch of other things that people are going through that are misdiagnosed, and they're actually Lyme's.
For years.
Or tick-borne illnesses. And the reason I asked was because I was taking the Japanese knotweed and some of the things you're talking about, so it made me curious to ask you why you're on those.
Well, mine was diagnosed, actually, well, not diagnosed, but found through my nutritionist is a microbiologist. So I go to him, and he looks at my cells, and he says you can actually see the spirochetes in the cells. Yeah.
So you got So you're a bit, And Lyme's too is a weird thing because the traditional treatments are different types of antibiotics and things like that, but they become resistant. They actually learn how to grow a biofilm around them that shields it from that type of specific antibiotic, and then you got to cycle off of that and do something new, along with all the other natural things. You got to do anti-cyst type of treatment and stuff like that. So it's pretty horrible. And the other thing is that, from what I hear, is you don't really get rid of it. It just lies in dormancy.
Right.
And it can hibernate between your bones and whatnot. So, but so far, I feel like just keep myself healthy, and I don't wait for things to happen.
That's it.
And but twice I was bit. And once, the second time I caught it, the second time I was on the front of my body where I could see it, and I noticed.
Yeah.
I noticed the bullseye target. I noticed the tick first, and then I got the bullseye, and I was like, oh, this again.
Yeah.
Yep. So
Yeah, so much. They're so.
Well, Rose, I'm glad to hear that you were able to not have to be cardioverted, and that you did
yeah.
back to normal sinus rhythm. And what's interesting though is that is that you took the time to listen to your body
Yeah.
and know when you were in distress.
Yeah.
And I think that's the biggest thing, even as coach, is learning to listen to what your clients are saying.
Yeah.
And trusting your own instinct always in what you're doing, even when you make little subtle changes. We ourselves are very much aware of them, and so making sure that your clients are doing the same thing and reporting unusual side effects, or if they're not feeling themselves, trying to ascertain why.
Right. Right.
Mm-hmm.
Especially when it comes to the diet. There's an abyss of diets out there, and
Yes.
some people get on these individual diets, and like my sister was on the plant-based, and she kept losing weight, and if there comes a point where you're not maintaining weight, then you have to look at, okay, so what else is the problem? Where's, you have to be able to, look for in different places for different answers and stuff like that. Yeah, it can be tricky with nutrition and disease and cancer and
Absolutely.
and yeah.
And Rose, we did have who was it at our conference there, Carl, that spoke on diet?
Yeah, I forget what those guys' name that was doing that brought up the fact that different nationalities.
Yeah, that was Dr. Andre Williams.
Right, that's the one. I was thinking it was David Williams. Okay, yeah, thank you. Yep. And he is under the school of thought of I can't remember the name now, but they found that different races and nationalities, especially where you came from in the world, generations past, have a lot to do with whether you react properly to meat or no meat, and what kind of diet. He's saying there's perfectly healthy Eskimos that don't have any vegetables, right, for generations.
Right.
There's perfectly healthy people that live in island and tropical settings that eat mainly fruits and vegetables and hardly any meat at all, if any. Perfectly healthy people. But why? And that's what they investigated. And they're finding that there's a way of telling what side of the spectrum that you're on and how much you need to actually incorporate, if any.
Right.
Does anyone know what that
Nicholas Gonzalez. That was the guy's
Gonzalez. I'm looking at the conference schedule.
Yeah, Gonzalez.
The Gonzalez diet. And they actually do blood typing, and they do a combination of a huge survey. And they find that some people are better off as vegetarians or vegan, and others are actually better with some protein or more protein. So it's all based on blood work and of course all the other factors. And they have had amazing success with people putting them on the proper diet that they should be on.
Does anyone knows what kind of test they
Can't hear you, Maya.
Yeah, it's just low.
1 second.
Yeah, the Gonzalez diet, and so look at that up, because it's actually science-based, and they've had wonderful results with turning people around and stabilizing clients on the proper diet based on their body needs, and so it's fascinating.
Can you hear me now?
Much better.
Yes, we can.
Yeah. I was wondering what kind of test they ran. Does anyone know?
Don't know that, but we do have his contact information, and he's definitely on our list of people to get back in touch with. And I'd like to know more about it too, because I believe there's a lot of supplementation that goes along with that diet. So I'd like to know what the real deal
So
is.
why don't we invite him on to come and talk to our group? I think many people would love to hear about the Gonzalez diet and exactly what it is and how they manifest and make decisions on the path for the client.
Yeah,
we
Zach,
were in
use one of the
talks,
cards you have, right, Zach?
Yeah, we were in talks of collaborating with him. We've extended the hand and extended the offer. He's a very busy man at his day job itself. So in due time, perhaps we will collaborate like that.
Yep. Yep, we're talking to people in the background always. We took names and numbers that whole conference, and we're getting in touch with them little by little.
Good.
I have to go for now. I will.
Right.
Yeah.
Good luck with everything.
Did you get my message, Carl?
I did.
Okay.
All right.
Thank you.
I'll see you for the
coming on tonight.
The coaches meeting.
Okay, perfect. All right, see you later.
Well, we have a few guests with us today, and
Yes, we do.
I would love to hear if they have any questions for us. So now would be a wonderful time. Trina or Carol, if you would like to ask a question or share something with the group, we would love to know if there's anything that you would like to know, or if there's anything you'd like to share with the group about what brought you here today.
Or introduce yourself.
Yep. Trina just unmuted.
Yeah, I did.
Hey, how are you?
I'm good. Can you hear me?
Yes.
Excellent. So yes, I'm over here in Phoenix. I've been diagnosed with stage 2 breast cancer, ER/PR positive, but no ER2, ER2 negative. So I'm trying to figure out which path to take. And so mistletoe, I'm going to just jump to my question. Mistletoe. I'd love to hear any feedback on that, people's experience with mistletoe, pros, cons.
Yes. Actually, at the CAM conference, we actually had Dr. Zubin speak to us regarding mistletoe treatments, and actually for the last 2 years. And now I know that it's relatively new and it's being heavily studied in the United States. We're actually using it in Canada as well. And of course, it's in Germany. It's being used extensively, especially at the clinic for Dr. Supek. And he does a combination of mistletoe IV therapy as well as IV vitamin C, IMF, and various topics in their clinical studies. But mistletoe actually they've had fantastic results with it, and yes.
Yeah, we could.
If you look in the chat, I have just put a becancer.org blog article that we have all about mistletoe, and I am going to grab a couple more resources from our lovely friend Dr. Zubin that Catherine mentioned. He is a good friend of the organization, and we're actually going to have him on as a special guest presentation near the end of the month. So stay tuned.
Really?
But in the meantime, I will send here some resources that he's already shared with us.
How is it administered?
What's that?
You want to find out when he's on then, what date? Because you really want to hear this man talk. He's amazing. And his specialty is mistletoe.
Yep. Maybe Zach, you can give the date and time. You have that.
Yes, so that's actually going to be a special event. Zubin is in India. India is in a different time zone. So right now it's like 1 or 2 a.m. in the morning or something crazy like that. So what Carl and I are going to do is on the 28th of the month, which is also a Thursday, we are going to get on at 8 a.m. Eastern Standard Time. So, of course, translate that to whatever your local time zone is. And we are going to have a special kind of meeting with him. Anyone is welcome to join and listen in and ask questions, much like we do here. And then come the evening session, we will play the recording or kind of talk about the recording that we made with him earlier in the day as a special presentation. But for anyone that is able to catch it live, I do recommend it. He is a wealth of information in mistletoe therapy being his specialty, but also health and cancer in general. So
And that will not be on Huddle, though, right? It'll be on Zoom. So
yes,
maybe
we're going to be hosting that on Zoom. So please do make sure you get the proper, appropriate link and instructions. I'll post that right here now as well.
Perfect. Thank you. That was my next question.
Carol or Zach, could you send the link so
Yeah, he's
I
doing
will
it right
do it
now.
like
He's putting it in the chat right now.
I will share my Facebook and
Perfect.
other social media. Yeah, he was one of the favorite speakers at the.
Yeah, we all went out to dinner last night. It was great. Yeah.
I really liked his presentation.
I need to share the photo now. There's the three of us. We all.
Yeah, I think.
I'm wearing the same shirt.
Great. Wow. So Trina, as a cancer patient, a breast cancer patient, I can honestly say I wish I had known about mistletoe. And after speaking with Dr. Zubin and seeing his presentations, and not only the results they're getting, but the fact that they're finding that 95% of the patients are not getting cancer recurrence, and that is profound. Okay, those are the kind of things that we want to look at, because it's expensive, but at the same time, when you looking at recurrence is what's critical, and why you're doing all these adaptive health changes that you incorporate with your whatever care you're getting medically, but also when you're looking at alternative and complementary medicine, is what can you do to augment your treatment, like vitamin C and mistletoe, or even alternatively, and not choose chemo, but it is, of course, a choice of yours. But it is really important to look at the history, and you're talking over 100 years, they've had fabulous results, and it's really and the American the big pharma guys are looking at this and saying, you know, there's something here for this, and they're opening up to for studies, and this is huge, because you know it's so hard for us to get in there and get the studies done. So you know, if they're allowing studies, that he is being recognized for all the work that's being done, and I fully support Trina. Please try to make the morning session, or at least in the evening, the recording of it, because I think you're going to find it very informative. I'll go back online also when we go that evening, and I will do some further research on nursing-wise and statistics, and see what I can find for you that we have in the medical libraries. All right? And all right. So if you have any questions, hopefully I can answer them more, and I'll do a little more detailed talk as a nurse. That helps, that I can have access to some of the medical libraries that are available throughout Canada and the U.S. And I think this is something that is really critical that you take a look at, especially stage 2. And you know, you're not stage 3, so using complementary methodologies, I really applaud you for opening your mind and doing this, because it's not just treatment now, but it's, you know, when the hospital says goodbye, we say hello, and this is when we have that opportunity to really support you and help you make decisions that are right for you, and just give you understandings in physiology, how some of these things work. And that's why a cancer coach is really most beneficial and will help guide you make decisions across your continuum of care, from diagnosis through to when you're done, and then further on. And there's a lot you go through. And so, yes, you're at least looking at something like mistletoe and some of the other products. Is there anything else besides mistletoe that you're looking at, Trina?
I'm definitely not going the radiation and chemo protocols at all. I've chosen to do alternative, and So I am working, trying to view supplements as being that. I'm a pretty good clean eater, but I'm learning now about certain items like spinach, for example, that I should not eat it. Yeah, I'm at that stage, but I've been in the homeopathic realm for a while, so it's not all foreign to me. But mistletoe was something new, it seems very, very interesting.
When
Yes.
when we were at the conference, there were so many different options were available. The doctors have been helping people with cancer, and they've been getting great success. It wasn't only mistletoe. There's so much out there that you can still learn, And this doctor is basically having greater success than by 75, 80, 85, 90%, by using so many different protocols or looking into cancer with the different eyes, looking into basics like your sleep, your routine. Those are the things that you also have to focus on when it comes your diet. We all know that you can eat a clean diet, but like you said, like you're learning, is the spinach good for you or not? Why isn't it not good for you? Those are the things that it's very helpful to talk to someone who can guide you better. And then, is your digestive strong? Why, in the first place, did you get cancer? What triggered your cancer? So those are the things it's more deeper to look into. And Dr. Zubin is a great doctor when it comes to mistletoe. He addresses a lot of aspects. That's like your mindset, your surroundings, paying attention to so many different things. Yeah.
I just put two things in the chat. One is the Zoom meeting. Again, that's the 28th at 8 a.m. Eastern Time. That'll be on Zoom. That's a live interview with Dr. Zubin. So if you're able to catch it live, I definitely recommend it. You'll be able to ask him questions on air right there. And that's a great value itself, being able to talk to him face to face. And then I put a link to a YouTube video. It's just an older video of his that he holds in high regards. He really likes that video as kind of representation of himself, so you can kind of get to know him and his work a little bit more as well.
Okay.
Absolutely.
Yeah, I'm glad, Maya, that you mentioned it. You got to get your house in order.
Yes, it's not
just,
only
it's not
one
just
thing.
mistletoe,
Yeah.
Get your whole house in order.
Yeah. It's not only one thing. There's so many things that you have to pay attention. Where your food is coming from. Organic is one thing, but what is it exactly coming from? What the ingredients? Because as coaches, sometimes when I read when someone posts a question on our group, and then there's so many replies to that question. Sometimes I go to those questions and I'm like, oh my gosh. And it's such a misguidance. There's a lot of misguidance out there. It's so important, like when you come across something, do your own research before you jump into the things. Some of the suggestions are just hideous, I would say.
Right. I have to constantly mention when the chats get long to only listen to the people that have the little moderator badge, because those are actually holistic cancer coaches.
Right.
And everybody else, they might be good, but we don't know if they're certified. So.
And besides being cancer coaches, we all went through cancer ourselves, and we experienced all those steps, coming through with it. So we have more detailed information than anyone out there who have no idea what cancer is.
Right.
Mm-hmm.
Well, we get a lot of shills on there too for RSO oil and stuff like that. They just let us spam.
Oh my gosh, there's so many hours. So when I see it, it just blows my mind.
Yeah. I got a little thing that triggers an alert for that, and they usually just get banned right away. So I think Carol had a question. You're unmuted for a little bit, and then you got remuted. Carol, do you have a question?
Carol, unmute yourself.
Oh.
Carol?
She turned off the camera by accident.
Yeah, I think
she's
it's
out.
I think she accidentally disconnected herself.
no.
You got shy.
I think on the phone
She
it's
did
hard
have
to. On the cell phone, it's hard to maneuver in the huddle.
Yeah.
Yeah.
Oh, I know. It's
Yeah.
Hopefully she finds her way back.
well, hopefully she does. But you know what? The nice thing is that we're on again. Oh, here she is. She's back.
Carol, we're happy to have you back.
There.
It's gonna hang in a second.
We'll get her back on. Carol, we have you coming on, so we see you there.
Yep, she's going through the preamble now. It'll ping in a second.
Yeah.
Great.
Welcome back, Carol.
Carol, you're unmuted, so you can ask questions.
Okay, good. Sorry, my internet connection just went off. So back again.
Okay.
I have a question. I've been diagnosed with bowel cancer, and I'm very determined to do it all alternative medicine. But I've noticed like a few people have actually opted first to do the operation first and then do the alternative. So I was just wondering if you have any feedback on the success, if people can just do it with all just alternative medicine without having the operation.
Well, Carol, every situation is unique, right? And I don't think anyone here is, although we have our own thoughts, our own opinions, our own experiences, ultimately you need to decide what you are most comfortable with and, you know, obviously consult with the appropriate person, whether that is an oncologist, a cancer coach, or whomever you feel is most qualified to advise you. Things to consider are how aggressive the cancer is, perhaps how much it's grown, and what, you know, state it is in, what your level of, you know, willingness to do alternative or holistic things is, and, you know, every scenario is so unique. There have been very successful and many cases of people who go an entirely holistic way. They avoid the surgery and they have absolute success for good and never have any concern. There's people that decide to opt for the surgery and then that's a success and they support it with holistic stuff. There's people that have the surgery and then unfortunately have side effects from the procedure, from the area, getting the local trauma of being cut open. What's that?
Oh, I think her internet is tripping up.
Oh.
As if her face is frozen.
Are you with us, Carol?
Yeah, her face is frozen. Oh, there we go.
Keep hearing.
Yeah, so, you know, is holistic healing possible without surgery? What?
Yeah.
Yep. Yep, that's going crazy.
Her internet is a little off.
Oh, we lost her.
Yeah.
She'll come back.
Yeah.
I hope she heard anything I said.
Yeah. But Trina, what I found as a cancer patient is that you know, you hear a lot of things on the net. You hear a lot from your family. The medical professionals are going to say one thing, and you know, then there's that whole cancer community that are supportive and being there too. So a lot of things is trying to personally make the decision that's right for you. For me, I decided having a bilateral mastectomy because I didn't have to use the breasts anymore anyway, but I decided not to have chemo, not to have radiation, and make it a mission for me to use holistic techniques to augment everything else that's done instead of chemo and radiation. So I've been, you know, healthy food choices. I've lost 60 pounds. I'm exercising every day. I do yoga. I'm a Reiki therapist, so I do Reiki on myself. And I'm also using infrared sauna. So there are many. There's not just one thing I do. I do multiple things that help me to move through different modalities, but incorporate them because there's no one solution. And I wish mistletoe had been there when I was 5 years ago, because I most certainly would have done that right off the bat.
Yeah.
But most certainly, when it comes, as Zach said, everyone's going to do different things, and it's so personal, and it's so unique. But the first step you've done is by looking at holistic modalities, and you have the homeopathy background. So how complementary is that to what you're going through? And it does make a difference because you know to research the right site, to not use Google, and to find sources that are right for you. So you're going to get answers that are helping you to make decisions, and you feel comfortable in control making those decisions.
Yeah.
That mindfulness and that peace of mind is everything.
Yeah, and consulting maybe with integrative oncologist would be, advice. My advice would be even one or two, and see what their approach would be, because everyone's very different. Some people are triggered by fear. If they won't have it, if they won't do the surgery, then their life is, they're not going to survive. Some people are so determined to do it without surgery, and they just go for it. So it all depends on your personal, the way you look at it. Surgery might temporarily take the cancer away, or remove the cancer, but that doesn't mean it's going to heal the condition. For example, on one of them that was mastectomy, the cancer still came back. So that's when I decided to go holistic second time. So you have to understand what triggers your cancer. That's the biggest question here. What triggers the cancer? What is it in there around you or within you that triggers that cancer? That's the main understanding that to know.
Maya, I think that is excellent, and I feel that is exactly where I'm at now, because I lived a very, I thought, healthy as much as I could on my choices life, and I wanted to know what triggered it that I would get it at this stage. It shouldn't have happened. It shouldn't have happened. So long story made short, I did find out that I had a parasite, and my GP doctor said, oh, everybody gets those kind of parasites, and he let it go. I wonder if could have triggered it, simply.
Well, here's the thing, though. There's a good parasite that our body needs, and they won't do, not good our body needs, I wouldn't say that. So they don't do a damage to our body, let's say it this way. But there's a parasite can cause a lot of damage. And the other things like for example, I always look back into the childhood, like at what age you got your first cycles, how heavy they were, what were you experiencing? Were they heavy? Were you missing them? So because the hormones, imbalance of the hormones starts all the way back there. Were you ever on any birth control? Were you ever on any hormonal therapies? Because all of those things triggers breast cancer. But birth control pills, believe it or not, 35% cause of breast cancers in females. So 35, which is very high. So you got to look back. So if people were on birth control, so there's a special detox program, for example, I go through for people who were on birth control. How can we reset that? So there's so many triggers out there. It's for you to look back into your history or your life and to understand, were you exposed to radiation? Were you exposed to anything? Glyphosate. Did you live in an area where a field was sprayed with glyphosate a lot? All of those things that you have to pay attention when it comes to cancer. And it's like removing the tumor is not getting rid of tumor. So that's the only thing. But some people, when they're afraid, they would go ahead and remove their breast and start from there, because that's how they feel comfortable, or remove the tumor and start from there. Some people just want to do it all natural. It all depends on the people.
Right. Root canals too.
Root canals, the teeth,
heavy correlation.
Heavy correlation. So chronic infection, diabetes, that's another thing people don't pay attention. High blood sugar, Like it doesn't matter when people say, "Oh, I ate healthy. I didn't have family history, of breast cancer in my family." But when I got it, I was in shock too at the age of 44, for example. So it was a question for me: why? Why did I get it? So that's like there's so much you gotta look into those things, like radiation exposure. I mean, like the clothes you wear, even the clothes you wear. If you're wearing synthetic clothes and you sweat in them, they would release chemicals. The hygiene pads, did you use natural hygiene pads? If not, they did release tons of chemical. And there's a direct, and they are direct endocrine disruptors. So there's so many things that we have to look into and know how to detox our body.
Stress,
Stress is another thing.
Caregivers. That's a huge thing.
Stress.
It's a whole topic in itself in our course.
Right.
The cancer-prone personalities.
Right. That's why we go so in depth with our clients. We learn so much about them to be able to guide them at least the right way, and then help them to find the right physician to work with. Share the links for them to learn, because education is the power of making choices.
And I think you'll find, Trina, that and as well as Carol, that on this channel you're probably going to hear us speak a lot on immunology, stress, healthy
digestive system,
especially your microbiome. We really like to concentrate on treating yourself healthily and your definition of health and wellness and the path that you're setting to get better, because that's your peace of mind and what you're doing and proactively bringing all of this stuff together is setting yourself on a path to success. And I'm hoping that that's where you'll find in this program, as we talk on various implementations and modalities, that you'll find the richness there to support you.
Thank you.
Also, if you're going to take a medical approach first, I might suggest that you look into integrative oncologist. At least you're getting a middle ground person there, somebody who has a little bit of knowledge on our side and knowledge on the allopathic side as well, and and hopefully they're not biased in any way, because there's definitely some centers that call themselves integrative, but they're really just chemo mills.
Right, and then also whatever you get suggested, it doesn't matter where it's from, your conventional, regular oncologist or integrative oncologist, you always have to ask questions why. Why are they suggesting this type of treatment for you? Why are they suggesting this type of IV therapies for you? What are they trying to repair in your body? So all of those questions you have to be asking. With the chemotherapy, so what quality of life you're going to have when you have chemotherapy? Does it even worth your time going through chemotherapy? Same thing with the surgeries. Some people jump into the surgeries. Like, I personally regretted that I went through, for example, But when I went through, I didn't know a lot. So that's another thing. So educate yourself before you make any decisions.
Yeah, and remember, trying one thing is you're always looking for efficacy, which is not only what does it do, but what other good things does it do as well in your body, and how it augments and supports any other treatments you're getting, and how blended you can get a very positive effect. That's
right.
Yeah.
Because putting your body into a stage where the immune system is going to go down at the most important time of your life, when you need that immune system to be very high and to be able to destroy cancer. So all of those treatments, they would bring your immune system down. It's a pressured time, like when you need to boost your immune system to help to make your body to fight the cancer.
Yep. We say a lot of people live despite the conventional treatment that they got.
Especially with the
Despite
chemotherapy,
it.
right?
Yep,
I
it's a
know,
race,
especially,
to the bottom. Yep.
especially with the chemotherapy, we need those natural killer cells, but the chemotherapy destroys them.
Yeah.
We need those natural killer cells to destroy cancer, but the chemotherapy, radiation destroys them. Medications do destroy them. That's why people cannot fight cancer or any other disease.
Well, another thing to remember is it takes a long time for breast cancer, most breast cancers, not super aggressive ones, but most breast cancers, to even show up to a size that can be picked up in a scan, in a mammogram.
Yeah.
It takes almost 7 years.
Eight to 10 years, yeah.
So it's a process that if you get if you're getting your house in order, you're addressing all those underlying things that were contributing to your cancer in the first place: the stress, diet, exercise, weight, blood sugar, spirituality, all the things that you would need to address. You give yourself a little bit more time to make decisions.
Right? Yeah. A month is not going to change a lot for people, even though doctors are saying right now you got to go for the surgery, you got to do this. In most cancer cases, a month or two is not going to make difference for cancer. But for you, if you're going to start changing your life, changing everything around you, you might see a great result.
I appreciate that. I was just wondering how long, because I am dragging my feet here, because I do not have enough information to make some wise choices. So that was nice to hear, Carl. Thank you for that. Because I'm working, September is when I was diagnosed, and I'm still working at trying to decide what to do next. Even though I had a lumpectomy, I did have the lumpectomy. But the rest of it is all on hold. Again, I'm not going to do radiation. I'm not doing chemo. I've just chosen not to do that. And I've chosen not to go on the AI. So
it sounds like you're on a good track.
Yeah.
You're in a good track and you are in the right place. I will kind of try to spark the fire under your butt a little bit and say, it's okay. Like we said, it's not the most, you have to, oh my God, act tomorrow. But you do want to be acting. You do want to actively be learning about things and implementing changes because, okay, maybe this month is one thing, but then those months kind of add up, and the more we put something off and ignore something, anything at all, ignoring something doesn't help. Yeah. So
that's where the coaches definitely come in, because they can work with you and you both decide together what's a good path.
Keep coming to our calls because we always share a lot of good information. If you have any questions, just write them down, and on Thursdays we're always here. You can hop on and ask all of those questions.
Yeah, and that's exactly what we're here for. It's a community that can really allow us to thrive, and a community that understands what we're going through and understands the route that we want to go really makes all the difference. Because now, if you show up next week, and then the next week after that, and you still tell us you're dragging your feet, well, now you're going to hear it from us.
Accountability.
We want to hear, what you're up to and all the good stuff that you're doing.
Yeah,
right.
Definitely.
And, if you read anything out there and you're confused, you don't know if that's the right information or wrong information, you can always bring that question here, and we will help you and guide you to the right direction.
Yeah, it's 8 o'clock now. We're getting up on the hour. But if you had questions and you didn't get them asked, just send it to support@beatcancer.org. That's support@beatcancer.org, and we'll get the questions answered for you via email. And if you come on the next week, we can talk about it again.
And the nice thing, though, Trina, is that you are being proactive by investigating what your needs are. That is crucial, and journalize what you're doing. That historically you can go back and control and manage what you're doing, and seeing how you react and evaluate your responses. Okay, so do that. But more thing is that the more information you get, it's important that you educate yourself so you can advocate for yourself with confidence and feel in control. because that's the one thing the medical system takes away from us.
Yep.
So it's
No control.
important to feel good about what you're doing, where you're going, and know that it's right for you. That's what's important.
Yeah.
I appreciate that. I hear that. Thank you.
Yeah. All right, everybody, we got to get off now, but we'll be back next week at the same time. And please come back. And if you got any questions, send them to support@beatcancer.org. And I wish you all a good night.
And for any of our
Good night,
coaches,
everybody.
Thank you.
12 minutes.
Goodbye.
Okay. Bye.
Bye.
Bye.